I would like to welcome to our presenter today is Dan Boulay, and he is from NextBend. So Dan, thank you so much and welcome to our first webinar that you have presented to us. Most of you know me, but if not, I'm Susan Culhane. I'm the Sales and Development Manager here at Nulty. And then Carrie Nicholson has been with us many times on these webinars as well. So welcome, Carrie. What Carrie's going to do today is she is going to monitor the Q&A. So we understand that ICHRAs are new to everybody, and you guys probably have questions. We had a lot of questions with the Nulty team when we were learning about what ICHRAs actually are. So if you have any questions whatsoever, please put it down in the Q&A, and Carrie will monitor that and we'll stop throughout the presentation. So our goal today is to educate you on ICHRAs. What the heck is it? Where did it come from? What does it mean for our future? We are not saying that an ICHRA is for everybody. We realize that this is not a fit for everybody, but as you know, all of our initiatives at Nulty is to educate, and we want to make sure you understand at least what it is and that you've heard about it, and then you can make a decision with the help of hopefully Nulty whether it's a good fit for you or not. So Dan, let's just kick it off and get into the first slide here. So Dan, I'm going to ask you, what the heck is an ICHRA?
It's a great question, Susan, and thanks everyone for having me today. Excited to kind of introduce the new concept of ICHRA to you, which stands for Individual Coverage Health Reimbursement Arrangement, ICHRA. I think we're all excited to have a new acronym in our industry. You can't have too many of those, but what it is, it's for the first time. This started in January of 2020. So it was new legislation that says for the first time, an employer of any size can use pre-tax dollars to pay for an individual health plan. So just like you do on a traditional group plan, you're using those pre-tax employer-sponsored dollars, giving them to employees. But instead of you picking a plan or two, the employee is going to have the entire individual market available to them. So that's the general concept that we're looking at here. And this has been around this concept has been around on a post-tax basis for quite some time. UPS did it back in 2014 and made some highlights, made some headlines about it. But this is really the first time it's really been a true viable solution with that same pre-tax advantage you get on the traditional group side.
Great. Yeah, and that's what we're, as we learn about this, and I think that's the big difference is what's the traditional plan versus the individual market plan. What does that mean? How does that all work?
Absolutely. So, why offer an ICHRA, and kind of what are some of the differences between the traditional group health plan that we're all accustomed to and the new ICHRA model? So as I discussed, this is the first vehicle that really allows employers to distribute those pre-tax dollars towards the employee's individual plan premiums. So some of the advantages of that is there's typically, one of the reasons that a group would move from traditional group to ICHRA is there's a lot of savings typically. Otherwise, it just doesn't make sense to do it. So instead of the employer picking 2 or 3 plans for the entire population of employees to pick from, the individual gets to be more of a consumer and have some ownership of that plan and pick the plan that's going to be the best fit for them and their dependents. So, there's also, in addition to the additional flexibility, there's savings. And then the other thing too is that these plans are portable, right? The employee, if they were to leave the company or whatever, these are their individual plans and they can take that with them wherever they go. So, those are some of the key differences.
Yeah, and I think that's, we who have sold the traditional group health insurance for so long, now potentially they have the opportunity to pick from all of these plans. And at some point, I don't know if we're going to get to it today in our webinar because we want to limit this to 45 minutes, but part of what Dan does, a big part of it, is he has a solution for offering this to the employees to be able to pick which plan is best for their family, and an agent can help out with that. So let's just continue on to the next slide and we'll keep talking more about it.
And before I dive in, I just want to I think the most common analogy of traditional group to ICHRA has commonly been the transition from a pension to a 401k. So you have that true kind of employer controlled group setting versus the 401k where there's that additional flexibility. So you can kind of think of traditional group and ICHRA along those lines too.
Exactly. Perfect. So again, the slide says it, but explain the key features. So just so we understand really what the benefit is.
Yes, absolutely. So I think this is going to be a common theme throughout today's presentation, and it all revolves around flexibility. So employers can offer an ICHRA and a traditional group health plan, but they just can't offer it to the same class of employees. So maybe you wanted to offer your salaried employees, you wanted to keep the traditional group plan for them, but your hourly or non-salaried employees, you wanted to say, hey, you know what? Let's offer this ICHRA. So you can do that. You just can't offer both to each class. So it's got to be separate classes, either ICHRA or the traditional group. So there's some flexibility there. The ICHRA is reimbursable for the premiums under an individual health plan, and it's also eligible for eligible medical expenses like under the HSA as well. So you got some flexibility there in terms of how you use those dollars. It's available to groups of all sizes. You can literally have a group of 1,000 or down to a group of 1. So there's no contribution, or there's no participation rules. There's none of that 50% participation. That all goes away. ICHRA does satisfy the ACA large employer mandate, so it's a true group health plan under ERISA. There's 11 classes that you can use to slice and dice your employee population, and I'll get into that in just a minute here. And the contribution levels can differ based on class of employee, age, family size, or age groups. So basically, the main rule is you got to have a 3-to-1 ratio between your largest contribution and your smallest contribution.
Okay.
As long as your largest isn't more than 3 times than that of your smallest, you can basically do what you want.
Okay. And that's what you're seeing other employers do. Just so everybody knows, Dan is not located in Michigan, but they sell this product all over the US. So what are you seeing clients do throughout the US with these types? What size employer is doing this?
Yeah, it's a great question. So I think when this first came out, everyone assumed, myself included, this was going to be kind of more of a small group play, and right. Our experience has actually been just quite the opposite. We've seen most of our success in the 50 to 500 space, and the first early adopters were really those groups, that essentially had a broken group plan. Either things were unaffordable, they had participation issues, very high claims. Whatever the case may have been, their premiums got to a point where maybe they were, seeing 30% increases year over year. And it got to the point where they're paying maybe $1,000 on a single premium for the highest deductible plan the health plan will offer. So, right. At that point, it's almost not a benefit. And so those have really been, the first adopters, at least with us in our program. We've seen average savings between 20 and 60%. Wow. We have some case studies that I can share with you guys afterwards and distribute that are really awesome stories. Some of these businesses were really up against it financially and couldn't afford next quarter's payroll if they didn't make a move like this. So we've got some nice wins on the scoreboard, and we'd be happy to share those case studies with you afterwards.
That's great. And I think that's what attracted us to this concept, because we also have a few clients that struggle with the pain points you just talked about. So, and that's why we wanted to make sure we were educated on it as well. So, all right, let's go to the next slide. Absolutely. Well, first, Carrie, do we have any questions coming in yet? Nothing yet. Okay, perfect. Okay. Let's go to, who is eligible? What type of eligibility classes do we have here that we can look at?
Yeah, so there's 11 approved classes under ICHRA, and they're very defined. So these are the only classes of employees you can use to actually class out, and create different classes. So unlike traditional group, where maybe you can say, hey, let's create a class for drivers or managers or kitchen staff, whatever it may be, you can't do that with ICHRA. You can't do it by type of employment, or job title. It really needs to fall within these 11. They're pretty generic: full-time versus part-time, seasonal, salaried, non-salaried, or hourly. Anything that's a union or collectively bargained, you can class them out. And then the other big one too is geographical rating area. So if you have a population of employees that maybe scattered throughout the country, it might make sense to offer in ICHRA for certain pockets of those employees based on their location too.
And
So
I
you can
think
really
that's,
have any
yeah.
combination. Oh, sorry. Go
No,
ahead.
no, no,
Go ahead,
no.
Susan.
I think the our clients and prospects who are on with us today who have employees in other states, so that geographic location, we're going to bring up a heat map and show you where these are very popular. And definitely that was something that we were like, that is really awesome. If you had employees in another state and the plans are rated so much better than maybe what we have in Michigan, that is a great option. And then I want to make sure we're hearing you. So you could have your management salary on a traditional health plan and then decide to do an ICHRA for hourly. Is that correct?
That's correct. Yeah.
Okay. Okay. So
You
I
just
think
can't offer both to both.
well, you can't offer
Yep.
both. Yep.
Yep.
So that's a great option for our clients as well. So.
Again, it's kind of that common theme of flexibility.
Right, right. And I think that that's what employers are looking for. They want to have more flexibility than what they have today. So what are some other eligibility issues that we need to be aware of?
Yeah, so to be covered under the ICHRA, the employee and the dependents, they must be enrolled in an individual health plan. It has to be. It can't be any type of group policy. It has to be a true individual health plan. And so the premiums of an individual, they're the reimbursable, like basically the premiums of an individual medical coverage to stay as a reimbursable expense under the ICHRA. You need to have all individuals covered on the medical plan, and the employee's zip code must be offered. So you can't say, all right, we're going to put everyone with this gold plan under Blue Cross. You have to offer the true entire market, which our platform does based off of that employee zip code. And then the enrollment must be the employee's responsibility, and the benefit selection is also the employee's responsibility. So that may sound pretty daunting, but our platform, we have a 1-800 number. We have decision support tools that can help the employee find the best plan that's going to fit their them and their dependents' needs. So there are some resources to assist with that, but in general, once the ICHRA is up and running, another thing to consider is that the relationship really exists between the individual and the insurance carrier at that point. So, again, there's going to be some more consumerism and a little more ownership of the plan at the individual level under the ICHRA model. And so, yeah, like I said, the employer involvement and the benefit selection, it's, really you guys provide the technology, and it's up to the employee to, pick that plan that's going to best fit their needs.
Right. And my understanding is, and what you have told us, is that the agent can assist with that. We can go out, help employees, sit next to them, advise them. But you're right. They need to do everything themselves. We can't do it for them. They do have to ultimately pick their plan because it is an individual plan. But agents can certainly have a consultative role in that and help them with that. The beauty of it is they have many more plans available to them than what they may have today with the employer groups, and they can pick a family that's one, for them that fits them financially and fits them from a plan design standpoint. So that's what I think is an awesome option for them. So
absolutely, and our platform gives visibility to the employer administratively as well as the agent. So you have those tools right at your fingertips.
Great. Okay, let's keep going on.
Very good.
So this is the big question. I'm sure people are probably thinking in their head, how in the heck does this work when it comes to contribution? So what do employers do? What are their options? Because right now they set their premiums through the entire year and what the cost share is going to be for the employer portion versus the employee portion. So talk to us about this, Dan. How does this look from the employer contribution standpoint?
Yeah, great question. And again, there's that common theme of flexibility. So, really the only rules around the contribution for an employer, there's actually no minimum contribution under ICHRA. So if you're an applicable large group employer, really the only benchmark you need to hit is that ACA affordability benchmark. You just got to make sure that, the employee's portion of the premium doesn't exceed, I think it's 9.5% of their household income. Other than that, under ICHRA, there really is no rules other than that 3-to-1 ratio. So you got a couple options you can do in terms of how you want to contribute and what you want to contribute. So you can provide, it's basically called defined contribution. You could give every employee the same amount. I think that's a good strategy for any employer maybe offering a benefit for the first time. It's a good way to have a kind of a budgetable contribution level and offer something for the first time. The one downside to that is, with ICHRA and these individual health plans, they're all age rated. So it's kind of a sliding scale based on your age and your location of what your rate is going to be. So the older employees pay more than the younger employees. So with that model, giving everyone, let's say $300 like we have in this example, the older employees might get the short end of the stick with that type of a strategy. So we also have a what we call a benchmark plan strategy, where you can, let's say you want to grab the lowest cost silver plan in a given market, and they have a set of rates. So you could say, oh, I'll do 80% of the age rate for all of my employees based off of that plan. You can do that. One thing you can't do, like you do in traditional group, most traditional group, you just pay a percentage of the premium, regardless of what plan people pick. You can't do that with ICHRA. You actually have to back into a defined amount some way, somehow. And by picking a specific plan, you end up in doing a percentage of that rate. You end up doing that. So you got to have a defined amount one way or the other. The other thing you can do, this is back to that 3-to-1 ratio, so hopefully that makes sense. Your largest contribution can't be more than 3 times that of your smallest. So if you wanted to, you could create some age bands based on that. So maybe you wanted to do, $100 for employees that are between the ages of 18 and 40, and maybe you could do $200 for 40 to 50 and $300 for 50 plus. Any version of that, as long as you maintain that 3-to-1 ratio, is okay to do under ICHRA. So again, there's there's even more strategies we could get into, but these have been by far the most popular. The benchmark plan strategy is a really good one. Those age rates follow that 3-to-1 ratio anyways.
Right.
So if you do a percentage of that, you're good to go on the 3-to-1, and it's easier to explain to employees. So those have been the most popular contribution strategies we've seen thus far.
Okay, that's what I was going to ask you. So, which makes sense to do it that way. So, all right. Any questions yet, Carrie? I'm assuming not.
No, Dan's just doing a great job covering everything.
Okay, perfect. All right, thanks, Carrie.
You guys are too kind.
All right, let's go on to the next slide. So really, let's talk about how does this benefit an employer? Because obviously we want to make sure that it benefits the employee, but we also need to make sure it benefits the employer. And what are these bullet points here that we want to discuss?
Yeah, absolutely. One of the biggest ones we see is getting rid of that participation minimum. That's a huge one. I'm not sure about Michigan, but I know most carriers do require 50% of all eligibles, or you can get non-renewed. And, I worked for carriers in the Minnesota market here for 10 years. And yeah, I saw it happen all the time.
It's better here in Michigan, I can tell you. They kind of They've
All right.
loosened that up a little bit, but it's certainly back in the day, we did have those participation requirements, but it's
Yeah,
got a little easier.
For sure. Yeah. With ICHRA, you could have 1 out of 100 employees enrolled and you're good to go.
Okay.
So then, it really does eliminate the guesswork too from, an HR or employer standpoint of that's a stressful thing. It's one of my favorite Office episodes when Michael keeps handing off the, the health plan selection. He keeps kind of hot potatoing it down to all the rest of the employees, but it is a stressful thing to try to pick, if you're limited to 1 plan or 2, maybe 3, depending on your group size. It is kind of stressful to pick a plan that's you feel is gonna be the best fit for your entire employer population. It's a very near and dear to everyone's heart. Healthcare always is, and you want to attract and retain employees. So with the ICHRA model, they get to pick the plan that best fits them. So again, there's that flexibility. There's also some cost predictability, especially for those that are in the large group. They're medically underwritten. The individual market rates have stabilized significantly since they first came out. I know locally here we've seen single-digit increases the last 4 or 5 years, and I know that's been the case, in most pockets of the country, as well as these markets have matured and stabilized. So, you're very unlikely you're going to be facing a 30% increase in the individual market at this point in the evolution of things. And then it really is, again, for even those whether you're a small group or large group, it does remove a lot of the burdens of managing the health plan, right? I think if you're that HR person and you got 100 people coming into your office, say, what plan's right for me? I got this question, that question. Our technology and in this legislation, ICHRA really allows the employee to take ownership of that, utilize our resources, and find the plan that's really that they can own and have some ownership of. So, and then you don't have to worry about renewals. And then if an employee does not buy insurance or does not use all the ICHRA money, the employer actually keeps the difference. So that's pretty nice too. So if their individual premium was only $300 and you offered them $400, you as the employer retain that $100.
Okay. All right. Perfect. Well, let's get to how it benefits the employees.
Yeah. Again, flexibility. I'm gonna keep saying it. You have more plan options, gives you the freedom to choose the plan that best fits your needs. You still have that same pre-tax advantage that you have on the traditional group side. You're just using it to find an individual plan.
Okay.
And then you have, like I talked about earlier on, you have that plan portability. If for whatever reason you were to leave the organization, you don't lose coverage. That's your plan. You keep it. It's portable. You take it with you.
So what happens with COBRA in that situation?
It's a great question. And it comes up quite a bit. And so ICHRA it does apply to COBRA. COBRA applies to ICHRA. So ICHRA is a group plan under ERISA, so COBRA does apply. So you still need to do what you're doing in the traditional group space in terms of notifications, doing that timely, whether you're doing it yourself or working with a COBRA administrator, you still need to do that. But here's the kicker. All of these plans, these individual plans, are guarantee issue and available on the free market, with or without ICHRA, right? So there's really not an incentive for an employee to jump through the extra hoops, do the paperwork for COBRA, and pay an extra 2% when they have this plan readily available, and all they have to do is set up direct payment when they do leave employment.
Yeah.
So we haven't had anyone elect COBRA for that reason.
Okay. Okay. Let's get on to the next one here.
Yeah. So
Actually,
groups.
Susan, we have a couple questions.
Okay.
Let's address those real quick.
Sure.
Let's dive into those.
All right, Dan, the first question is, can the leftover money go to the employee rather than forfeited back to the employer? And I think you just answered that question.
Yeah, it would need to be, the only way you could do that is if they had like an individual, like maybe dental plan too. Just those dollars have to go towards individual plan premiums or eligible medical expenses. So otherwise, the employer is going to retain those dollars.
Okay. Okay, great. One more question. Can you help the participants understand the potential impact of employees on an ICHRA versus a self-funded group health plan regarding cost containment strategies and design components?
Yeah, we're really kind of talking apples and oranges here. And the reason I say that is, when you have a self-funded health plan, obviously managing those claims and managing risk and creating programs around that is a key to success. Really, the claims do not matter under ICHRA. I mean, you're getting out of that game entirely, and that can be a good thing or a bad thing depending on your situation. But I think most find that it's a good thing. And like Susan mentioned earlier in the call, we're not here to suggest that ICHRA is the solution for every group or perfect for every group. It's really designed. It's a new model that provides kind of I'd like to think of it as like a new safety net for groups that have a unaffordable or broken group plan, or are looking to get something off the ground, maybe like an association or something that's typically tough to get started and needs medical underwriting or health apps or whatever it may be. But really, when you go to an ICHRA, you're really getting out of that risk management game. So I think that's the best way I can answer it.
Okay, great.
And I think it goes into our next slide about potential that what type of groups this might be a fit for. So
yeah, so obviously small groups and large groups with some of those higher claims. We talked about that. There's no group size limitation or anything like that. I touched on groups with participation issues. All that goes away with ICHRA. And then if there's groups with contribution concerns or affordability or budgeting concerns, there's going to be some flexibility with ICHRA, whether you offer it to a pocket of employees or your entire employee population. You got some more flexibility in terms of what you contribute and how you do it. I know, at least here in Minnesota, and I think this is probably true in Michigan as well, you typically on a traditional group plan, you got to contribute at least 50% of the lowest cost plan you're offering. It's usually around there. Again, that goes away with ICHRA. You just have to meet that affordability threshold through the ACA if you are a large group. And then I did just mention like associations, co-ops, franchises, things that have typically been an underwriter's nightmare. Let's put it that way. Anything that's difficult to get off the ground and traditional group health plans typically don't want to take a look at are a very good candidate for ICHRA because it's all guarantee issue. You can get this off the ground without any underwriting. And then lastly, industries such as hospitality, entertainment, anything that's seasonal, low wage, high turnover, restaurants. We see a lot of home health care, trucking firms, manufacturing. So I mean, there's a lot of industries that are kind of fit that mold of lower wage, higher turnover, and for one reason or another, maybe facing participation issues or affordability issues, and could benefit from the ICHRA.
Hey, Dan, I have a quick question. So back in the day, there used to be chambers of commerce plans. So could a local chamber of commerce offer this type of plan? But the problem with that is it's all different types of risks, different types of industries. So when you say association, co-ops, franchises, do they have to be the same type of businesses?
Yeah, I mean, in fact, they even got to be a true AHP. Okay. It can't be like a, I don't know. It wouldn't be like a chamber of commerce, anything like that. You got to be a controlled group as a AHP. But yeah, so those same kind of control group guidelines still apply.
Perfect.
But we do have some we're talking to a couple of PEOs right now. Mm-hmm. Now they're not commonly owned or anything like that, but the leadership of the PEO wants to, on a group by group basis, have a canned, contribution model that they can use to get a benefit offering off the ground. So just because they're not commonly owned doesn't mean you can't do it. It's just got to be on a, group by group basis.
Perfect. Okay, let's go on to the next slide here.
Sure thing.
So this is a really important slide, so everybody really needs to pay attention because there's definitely some considerations with this. I don't necessarily want to call them downfalls or pitfalls, but I think you need to know where what the differences are, and these are three for sure that we want to make sure. So talk to us about the narrow networks. What does that mean?
Yeah, absolutely. I think some of us may have remembered some of the headlines back in like 2014, 2015, when these markets first came out. You hear about United Healthcare bailing on a certain market, across the country. You'd hear about Aetna, Cigna pulling back. They're not going to do this market or that market. And one of the cost containment strategies that the carriers did was to narrow the networks in the individual markets as they matured. I can tell you that since the markets have matured now, they're getting a little more expansive. I think the carriers are more comfortable with where things are at, but by no means is there that large national open access network that you get to enjoy on the traditional group side. So I think the network is by far the biggest drawback from the ICHRA. We always say you can find the provider of your choice. You're just gonna have to do your homework, and we've got the tools and resources to help you do that. You just got to find the right plan and the right network. So those providers are not excluded. They're just kind of isolated to certain plans. So you just have to do your homework to find out who that is. So
very similar to like an HMO plan. So very
Yes.
similar, I'm assuming. But if
Yep.
I go on vacation with my family and I have an emergency come up, whether it's an illness or an accident, I still would have coverage.
You still have that in-network coverage, correct?
okay.
If it's emergent care, correct?
Good. Yeah.
Non-emergent care, yeah, you're gonna be looking at out-of-network benefit.
Right. So if I'm in Michigan and I get diagnosed with a very rare condition, I'm not going to be able to go to Mayo Clinic in Minnesota for treatment with this type of plan.
Mhm.
Okay. All right. Let's talk a little bit about subsidy and tax credit too, just so people understand
Yeah.
that is impacted.
So yeah, absolutely. So like I mentioned, ICHRA is a traditional. It's a group health plan under ERISA. So if an employer offers affordable coverage through an ICHRA, that employee is not going to be eligible for a tax credit on their state exchange or federal exchange. Really the key here is that an employee can't get both, right? They can't take advantage of the pre-tax employer contribution and go to the exchange and get a subsidy. So as long as that employer is offering affordable coverage, that employee will not be eligible. So if it's unaffordable, then they got to do one or the other. Can't do both.
Got it.
And then, obviously this is very new. I don't think anyone's an expert at ICHRA yet. We've had really, while this did come out in January of 2020, no one really knew what it was or how to implement it or how things work. So really, January of 2021 was kind of our first, open season of really, diving deep and selling ICHRA. And one thing I've always said this: the one thing that probably the two biggest takeaways that I got, watching groups succeed and other groups that had some struggles, is that the groups that succeeded did a really, really good job of educating their employees. Hey, why are we doing this? Well, we can't make payroll next quarter. whatever the reason is, this is something we have to do, but here's some good things about it. Here's how it's going to work. And we can do our demo and really set the stage so employees know what to expect and what's in front of them. That's a key component. And
Sure.
You can't do that if you try to rush things, right? So I think, I come from the traditional group space, and I think a lot of us on this call can probably relate to this. In the traditional group space, if you want to renew, you could probably even do it retroactively if you wanted to. You could be like, you know what, let's do it June 1st. It's the 23rd, but let's make it happen. You've got some flexibility in terms of getting people enrolled. You can do it retro back 90 days sometimes. That goes out the window with ICHRA. We're dealing with individual market rules. There's like no flexibility. So buying time to educate and get things done and really not rush it is another key to success.
Yeah.
So you just don't have that same flexibility.
Okay. Well, we have a few minutes left and I want to get to this heat map. So let's go to the next slide real quick.
Sure thing.
And so we want to show this heat map to you where these are popular today based on the comparison to the traditional health plans versus the marketplace plans. So Dan's going to bring this up. It's an interactive map. We can also share this with you when we send you the presentation so you can play around with it. But as you can see, it's for a 50-year-old. And it's for a bronze plan, which you probably all know this already, but there's 4 types of plans on the marketplace: bronze, silver, gold, and platinum. So this is for a bronze plan, which is not going to be a fantastic plan, but he can show you real quick how this works and when you compare it. So if you have employees that are out of state, this might definitely be something you want to look at. Michigan, not that competitive yet, but I'll let Dan take it over and talk to you about that.
Yeah, so this is kind of a heat map that really shows you, I guess, the delta, if you will, between the individual rates and the small group rates. Typically 50 employees and under. Some states have 100, but so these are all filed rates. So each carrier across the country files these rates for they're actually probably doing it right around now for 2022. So that really kind of sets the stage here for the following year. So in areas that we see that are more gold, that's where small groups are actually going to be a little more expensive than that of individual. And the areas that are blue, individual is going to be a little more expensive. So it's actually by county. So all you need to do is hover your cursor over the county, and let's see if I can find.
Go down. You're getting close.
Thank you.
You're really close.
All the guidance I can get.
There you go.
Oh, I had it.
That's okay.
Yeah, so if we look at Kalamazoo County, individual is actually 22% more expensive than small group, right? So if you're a small group, probably not a lot of incentive to do, in ICHRA. Why would you pay more and go to a skinnier network? Just doesn't make sense. But you get into that, large group space, or maybe you have employees in Minnesota or Colorado, New Mexico, some good areas. It certainly can make sense. So just because you're in a blue area here, we'll go back to whatever.
You're close enough. I think the key is, though, like you had said, is that small group, and that would be the age banded rates. So anybody up to 50 employees. But if you're a large group, you guys can look at that rate right now and you already know where you're at. Some of you might have a large group premium of $550 or $700, depending on the plan. So just so you know, this is small group rates. Yep.
So, $424 for an individual plan can be extremely attractive if you're, underwritten large group plan is, like she said, it's $700, $800, something like that. So it's, but yeah, we'll send this out. This is a pretty cool tool to kind of, have the conversation and get the wheels turning. So, and one of the things I'll mention about ICHRA too is, it's never a bad time to learn about it because you never know when that renewal's coming. Might not be a fit today, but it's certainly something you want to get educated on and just know that it's out there for a rainy day.
Yeah. Well, thanks so much, Dan. Probably a few questions that people might have is, and we have about 5 minutes left, I think.
Yeah, we do have a question, Susan,
okay. Thanks,
since
Carrie.
we have a few minutes. How does the ICHRA, or how would the ICHRA be better for an employer that does not offer a health plan, but may offer pay increases, and then the employee takes that to the market and buys their own?
Yeah, so the employer and employee are going to get the pre-tax benefit through the ICHRA. It's all going to be done post-tax just by raising the wage.
Okay.
Other than that, the concept's not too different.
Okay. Right. How about implementation? Like, what does it take to implement an ICHRA compared to maybe a traditional group health plan?
Yeah, it's certainly a little, there's a few more moving pieces. So basically what our platform does, all the employee has to do is log onto our platform, look at our marketplace, pick their plan. They're done. They don't need to pay anything out of pocket, right? So the way our model works, it works just like traditional group, where the employer pays 100% of the premium and recoups the employee portion via pre-tax payroll deduction. And then the employer, we have an employer portal as well. All they do is set the contribution and then pay 100% of the premium to us each month. And then behind the scenes, what we do is we attach those dollars to each individual's submission and policy, and we send that off to the carrier in their preferred enrollment format and their preferred payment format. So that takes some time to set up. So we typically tell groups, you should be saying yes and starting the process. We have some paperwork and starting your education plan with the employees. You should be starting that typically about 60 days out from your desired effective date. In a perfect world, really our drop dead is about the 5th of the month prior to the desired effective date. So if you wanted to do an 8/1, we're looking to have enrollment done and payment done in our platform no later than July 5th.
Okay. Well, great. I'm sure people are probably wondering, how do we get billed and how do we pay for this? So, all right. Well, we have 2 minutes left, and we have the all important drawing for our breakfast gift certificate that we like to give away, obviously supporting local restaurants. So I'm going to bring up the participant list here, and then, hey, Carrie, why don't you pick a number between 1 and it looks like about 45.
All right, let's do lucky number 20.
Okay. That is Scott Schimming from Logiequip. So Scott, we will reach out to you, and you're going to get a $50 gift certificate to it could be a breakfast place, but it could also be a lunch place or a dinner place. We don't care. So we just want to support our local restaurants. This is a recorded webinar, so you guys will all get this who attended. Dan, thank you so much for being our guest speaker today with NextBen, and we appreciate the partnership. And if we have any more questions, we know we have you as our resident expert. And if anybody else is interested in learning more, reach out to your Nulty contacts. So everybody have a fantastic day. Enjoy your summer. We'll do another webinar probably in August. Take care, everybody. Thank you.
Thank you all. Have a great day.
Thanks,
Bye-bye.
Care.